So digital inclusion is really important to us in the health and social care sector to make sure that the communities that we serve and the people who access our services can access in an equitable way. We need to make sure that we continually innovate and change and give people different options to engage with the health and social care system.
Historically, we utilise paper records. When they go to see the midwife, they bring it with them, we'd write into it. Beneficial because it moves around with them, but also a real risk because they were often left on the bus or turned up to an appointment and you hadn't brought them with you. We've seen quite a big change within maternity services. So now we see women come in and they get offered a mobile app, meaning that they, in the same way, they can take the records and they're far less likely to get left on the bus. And then we can publish their records to them, and there's a wealth of kind of information available through that.
It's had its ups and its downs that we've all had to navigate, and that's not only for staff but it's for the women as well. So it's a completely new way of doing things. So all of the women's information, their appointments, their results, their scans, their education.
And access to leaflets which cover key messages and key public health information that we share with them during their pregnancy.
Within our region, we've worked really well collaboratively to make a move to one single system across the maternity providers and also neonatal as well. That means that we can share records. So really important that because of the way that maternity care works, that you can live in one local area and you may choose to give birth in another area. You can be referred on to other places because your baby needs specialist care when you're born, or because you need to see a specialist consultant that works at the tertiary centre, for example. So it's really important that no matter where that family move to and they receive their care, that they have the clinicians have the access to the same information, and so do the family.
It matters because we want to make sure we take care of people in the best way possible, in a way that suits them and is accessible to them. There's lots of legislation around this, but most importantly, it's providing the right care at the right time for the right person. There's lots of challenges within the North East and North Cumbria in particular about access, and digital is a way that we can enhance the offer that the health and social care sector can offer, but we must be cognizant that not everybody can access it in the same way. We need to make sure that we're providing fair and equitable access for everybody, not just the majority of people. We have to think about how we communicate with people who English isn't their first language, and that can include people who are BSL users, for example, or have neurodiverse needs. And it's really important to think about what the needs of our population are.
Digital poverty is something that we really need to address because the world is changing. The younger generation have been brought up and raised basically with a phone from birth, and then the older generation might not actually be as in touch with technology, but to make the digital transformation work the way we want it to, we have to make sure that we've got a plan in place for them women. The divide will become bigger when everything advances much quicker and the people that don't have access get left behind. So if we're going to make a change and we want it to be better, it has to be better for everybody, not just for those who can afford it.
We know that women or people that live in the most socially deprived areas are more likely to experience health problems and also have a lower life expectancy. And those people really need us to help them. And if they don't have the simple tools that they need to access the information that you or I do, then they're not going to get the benefits.
So one of the ways we're kind of trying to help combat digital exclusion is that through the work that we are doing within the communities, the toddler groups, the acronatal groups, all of these different activities that happen. My role as the lead is to attend these groups and to get to know people and to hear about their experiences. And as we come across people that are digitally excluded, as we're coming across people that need help in that situation, that's where our working relationship with the trust is really helpful.
So currently we are able to offer them the device and offer them the SIM card, but I am very aware that we're relying on the midwives on providing that digital skills support. There is little workshops that are set up, particularly with the Hope Foundation. They do like lunch and learn so that they can get people to get involved in, if they don't know how to set up an email address. You'd be surprised how many people who are digitally excluded actually don't even have an email address and wouldn't know how to make one. And there's definitely a lot more work to be done with the digital skills development.
At the moment, several of the women on my caseload are homeless and they live in a transient lifestyle. They're sofa surfing, going from house to house. Some nights they don't have anywhere to stay. So access to technology for them is essential. because it enables them in so many ways. It enables me to keep in contact with them, to see where they are, what they're doing, how they're managing, how they're coping. It enables them to keep in contact with other people and other services like housing, like social services. We've been fortunate for a couple of these women that we've actually provided them with a handset and a SIM card so that they're able to use it to sort of ease their hardship right now. We can work together to make things better for them.
So quite a few of the women that we care for are asylum seekers. So they might have come into the country quite recently or have been moved around the country quite a lot in their pregnancy. They have very limited financial income. So in terms of accessing data and minutes for their mobile phones, that can be a challenge. So I've had a number of women in that sort of situation where we've been able to provide a SIM card or a mobile phone for them to be able to use through their pregnancy for accessing their maternity notes, but also for accessing us in terms of making appointments, keeping in touch. You know, one of our key messages in maternity is always, if you have any problems, ring our advice line, which only works if you can actually ring someone. So being able to give women that capability means they have really easy access to maternity care when they need it. And then not just within maternity care, within wider healthcare, housing, social care, even just being able to access and find out what's going on around them in the local area where they can go and meet other families. A lot of this information is all online.
The women that we've helped with the phones, I think, are quite overwhelmed that we can give them a device. So a lot of the time the women think that we are going to ask them for the phones back, and we don't want. Once we've given them that device, it's theirs to keep. I don't give them it even thinking that they're going to use it just for their health. If they use that device and that data to access cartoons on the phone to give to their other child whilst they're in their appointment, or just so that they can have a little bit of time to, you know, decompress after a busy day, that is doing just as much for the woman's well-being as accessing her individualised care information. It's not just about giving them access to the health records, it's about integrating them back into society so that they've got just the same opportunities as everybody else.
So moving forward, I think a focus on giving women those skills is what's going to help them be able to be included in the digital transformation and ultimately improve their outcomes and their experiences of care.
Well, I'd like to see that everybody was able to access the services they need digitally, and that would free up capacity elsewhere in the system so we could concentrate on the people with the greatest need. Hopefully we'll see a positive impact on things like waiting lists and patient safety and patient experience. That's what I'd like to see digital do for us.